तातूंत आमी चेंज करूंक जाय की सेक्शन 6(3) आहा, वेर अशें आसा की सपोज तुवें चार्जशीट फायल केली की तुवें सपोज कोणाक मारहाण केल्या कितें केल्या ताची डॅमेज जी आहा ती पयशे तुवें पयलीं भरचे पडटले. कित्याक आमचें कशें आतां चार्जशीट फायल करतकच 25 वर्सांनी ताचो रिजल्ट लागतलो. तो म्हणसर नोबडी इज बॉदर्ड. So once he has to pay that in advance and keep it as a deposit with the government, then the people will feel that but there is a pinch in this. So म्हाका दिसता की all this law has to be properly ताका teeth दिवपाची गरज आसा. आणि आय एम क्वायट शुअर आमचे पोलीस आर तसे लिटरेट आहा गोंया आमी मच बेटर आर देर. बट IMA हॅज टू कम अशें आमकां प्रत्येक फावट डेंटल कॉलेज सगळें आमचे हॉस्पिटल टू करपाक सगळें इज व्हेरी इम्पॉर्टंट. सो इट इज इम्पॉर्टंट.
Deadline should be 302 cannot be made.
302 म्हणजे मर्डर नाही.
302 cannot be made
cannot
applicable
be.
in a hospital.
हॉस्पिटल सेटिंगान तो घालूंक शकना.
Cannot be made.
302 लावप म्हणजे हाच्या सारक्यांनी मूर्खपणा ना. म्हणजे पोलीस तो आयदर ही इज रियली प्रेशराइज्ड बाय एवरीवन or by political necessity. So I feel that police also has to act with the sense of responsibility.
जर तुम्ही ते कमिटी सांगलं ते प्लेस करता आउटसाइड हॉस्पिटल कमिटी.
No, the committee governmental form करपाची. See, IMA कडे redressal committee आहे. So they can come to IMA also, but IMA कितें जाता इट लायक अ प्रायवेट बॉडी जाता. पण गव्हर्मेंटान जर कमिटी केली, फाटल्या फावट आमची अशी केस जाल्ली तेन्ना हॉस्पिटलान, वी सॉल्व दॅट केस आनी ताजो चेअरमॅन आशिल्ले आमचे रिटायर्ड जज कामत. तातूंत आमी प्रेसाचेर घाल्ले मागीर पब्लीक प्रोसिक्युटर आमची कमिटी आसा. गव्हर्मेंटाची कमिटी अजून करूंक ना. दॅट्स वाय वी आर ट्रायिंग टू प्रेशरायज द गव्हर्मेंट टू मेक दॅट कमिटी फास्ट वीच कंटेन्स ऑल द सेक्शन ऑफ द सोसायटी. आणि त्या सोसायटी कडे लोकांनी वचपाचे. फर्स्ट गो टू द कमिटी, आणि त्या कमिटीन सांगले की येस देर इज अ रिझन की देर इज अ सम प्रॉब्लेम, देन ओनली द पोलीस कॅन फाइंड इट. नाव वेन वी प्रॅक्टिस there are some outcomes which are not in our hand, and Constitution of India also accepts this as a profession different from any other profession. Biology, medicine cannot be mathematics. Here 2 plus 2 is not always equal to 4, and that's the reason Constitution gives us some privileges, like a person dies in our hand, there are ways out. You think there are negligence on our part, there are ways out. As Dr. Shekhar told you just now, we can go to committee under Medicare Protection Against Violence Act. We can go to Goa Medical Council. We can file a case with police also. Police has to give it to a board specially appointed for this purpose. National Medical Council is there, which has laid down guidelines how this board has to be formed, and that board will decide if doctor has committed any negligence. If doctor has really committed any gross negligence, this committee will tell the police, please proceed with the case, and then doctor can be punished. We have no objection to all this, but law being taken in your own hands, humiliating the doctor, and especially in this case now, when a thing like postpartum hemorrhage, which we know is a common complication, doctor has tried, has struggled for 4, 5, 6 hours, transfused blood. In spite of all the efforts, patient has died. Family was there along with, family has understood, but then when the cremation is taking place, somebody, politician, just lifts the body, gets it, and then mob gathers, police file a wrong case, humiliation to doctor, and one of our colleague commits suicide. Not acceptable, not done. Today we are here to pass a message to public. Who suffers finally? Tomorrow, for fear of PPH, if I don't take a case, PPH is postpartum hemorrhage. If I don't take a case, postpartum hemorrhage, I don't handle. I send patient to refer to patient to GMC. All at-risk patients I refer to higher centers. Who will suffer? You are tying our hands. You are tying our hands and putting us in a swimming pool and tell us swim. No, not possible. Please give us free hand and we'll give our best results possible. But for that reason, don't tie us up. Don't put that sword of Damocles of all the acts and laws on our head. कायदे सुचलतात, पुढे नाका आशिल्ले मॉब येतले, म्हाका धरतले, धमक्यो, एक्स्टॉर्शन तसले करपाचे ना. कायद्यान कितें आसा, कायद्यान सगळ्याक पाठो दिल्ले आसात. फॉलो करा कायदे. वी हॅव नो प्रॉब्लेम फॉर दॅट. पूण हें करपाचें बंद जावपाक जाय, ना जाल्यार हाजो त्रास जातलो पेशंटाकूच, जनरल पब्लिकाकूच. पोस्टपार्टम हेमरेज पेशंट हांवें ट्रीट करनासतना जर हांवें फुडें धाडपाक गेलो जाल्यार ती वाटेरूच इतलें ब्लिडींग जातलें पूण हांव सुद्दां तातूंतल्यान. दीस इज नॉट वे. कोण सफर जातलो कित्याक हें अंडरस्टँड जायना पेशंट म्हाका खबर ना. सो हे ते पॉलिटिशियन त्या गुंडांक सांगपाची वेळ आयल्या. हांव तुमच्या प्रेसा कडेन मागतां प्लीज पास ऑन दीस वर्ड की हें जर चालू उरलें डिलिव्हरी ऑफ मेडिकल केअर वील सफर. इट्स नॉट डॉक्टर्स हू आर गोइंग टू सफर मच. हांवें मॅनेज केल्ले पेशंट हांव म्हजे कडेन जायना म्हणटलो फुडें धाडटलो. चलचें ना. ऑलरेडी आमचें टेन्शन येवपाक लागलां. खंयच्यान वयच्यान तो कंज्युमर कोर्ट एक्ट बसता, खंयच्यान पुलीस केस जाता, नाका आसतना पुलीस पेशंट लोकांचे पेशंस काबार जाता. प्लीज खंय तरी हें सोंपपाक जाय म्हणून आज आमी सगळे एक जाल्यात. हात जोडून मागतां प्रेसा कडेन आनी जनरल पब्लिका कडेन प्लीज हें खंय तरी सोंपयात.
Fellow, a very senior obstetric and gynecologist from Margao.
It's a very sad thing what is happening. I'm a very senior doctor. Now, when we were students, we hardly used to see such cases. And as the doctor takes the oath that he or she is going to save lives, and to be called as a murderer is just beyond imagination. And I really felt very, very sad all these days that a young doctor lost her life because of the unnecessary interference by the general public, by politicians, and also the police, and also the media, because they just hyped the whole thing without understanding what exactly has happened. And as a doctor, we take a Hippocrates oath to save lives. We do not kill. And when we are operating, God only knows. And we know through what stress we go. And how much we are also praying to God to help us to overcome that stress and to save a life. And such unfortunate things, if they happen, the media and the public have no say at all in this. They cannot accuse the doctor. Because every doctor is born, a doctor is born. Because I say why born? Because we decide when we are very young at the age of 18 to become doctors and to serve humanity. And to serve humanity, our duty is to save life. And unfortunately, if things happen, but that does not mean that the doctor should be crucified. The doctor has to be respected. Because the way the things are going on in our country, there will be very few young people wanting to become doctors. So what is the sense of becoming a doctor? So first of all, a doctor doesn't earn that much. People think that we earn a lot, but it's not true. And the stress that we go through, and as this thing, if they are going to continue happening, there will be very few people or youngsters wanting to join the medical profession.
Of Goa Medical Representative Association of Goa. Today we are here solidarity to the medical fraternity to support the protest here for the assault of doctor. Today we see a lot of assaults happening in on doctors. I think we should need to understand that there could be many reasons for the death of a particular person. I think we also must understand that we should not assault doctors also. And these are the doctors who work for us, for the peoples, for day and night. And these are the doctors who are there for the emergency service throughout the day and night. So I request on behalf of our Medical Rep Association to do not assault these doctors.
What went through the minds of Dr. Archana is unbelievable. Leaving her children behind to leave this world in her act of saving life is something, like everyone said, just unacceptable. We have to understand one thing, that there will be maternal deaths. APH and PPH are the nightmare of the obstetrician. Antepartum hemorrhage and postpartum hemorrhage. Deaths due to this are happening in the best of centers across the globe, not only in India. And because of doctors' hard work, the maternal mortality rate has come down 1,000 times if you go back 50 years in time. And this is because of the life and time sacrificed by the obstetricians. We have to understand that there will be PPH. For one death that happens of PPH, 1,000 deaths are stopped by the doctors. And if these doctors are not treated properly, can you imagine what will be the plight of the patients? We will be scared to treat them. All of my colleagues here who are here, Dr. Kama, everyone here, has saved so many lives on the table you cannot imagine. And PPH is something that happens on the spur of the moment. Patient bleeds 2 liters in 1 minute. and to stop that bleeding and save the life is something that doctor struggles. They have donated their own blood to save life so many times. So please pass on the message that this is a common complication which will happen and doctors cannot be harassed at any given point of time. Thank you so much.
Yes, care for the doctor if you want to see that your health is well taken care of. That should be the bottom line, because if you don't treat the doctor properly, if you attack the doctor, if you try to create problems for the doctors will definitely hesitate. Especially in serious cases, doctors will get frightened to treat such patients. They will refer them to the government hospitals. By the time the patient reaches the government hospital, there will be so much loss of time, there will be more loss of life. So please pass on this message to the general public that we doctors always struggle, we give our best, we forsake our family, we forsake our own lives. Nights are not nights for us, they are days. And we do it in order to see that our patients get well. It is not a question of earning money like many other professions. It is a question of medical science to treat these patients and to get them to life. That is the greatest joy we get. So please pass on this message that we doctors will try our best, but the people should understand us and should not resort to such ugly, violent methods. Thank you.
Request, I'm Dr. Govind Kamath, obstetrician from Tangent. My only request to the media, both print and electronic media, that whenever such a case happens anywhere in Goa or India, you must first confirm what has happened really, without giving an opportunity to the doctors, to the medical professionals to learn what are the sequence of events that have taken place which led to this complication. You should not hide this in the local media or this, because once the sensitive news comes in the media, people they don't understand anything. They say that whatever has come is the truth, which is not the fact. So my only request to all the media is, please, first learn or discuss with or study the case and then report. There is no harm in reporting, but it should not be sensitized. It should not be hyped. Facts are to be reported. This is the only request.